We're back to the Neil Haley Show, and this topic's very interesting to me because, again, sometimes we're missing out in thinking about the woman's health when it comes to pregnancy. And my guest today, and I want to know also why he calls himself the rural doc, Dr. Alan Lindemann, supports women in taking charge of their health and their pregnancies. Dr. Lindemann, thanks for stopping by. How are you?
I'm fine, and you?
I'm doing great. And kind of looking at your mission and vision, why you're going out there, you wrote the book, all those different things. What was the reason you came out there to tell the public what's going on?
Back when I was a third-year student, I recognized on our rotation that the one rotation more than any other you get to choose your result. It's not like a heart attack when you're repairing a heart. You get to get in on the ground floor of a new life.
And that's so true. Great point. You said this, and then in new life. And what do you think was missing that you want to go out and tell people about how people are taking care of pregnant women, especially when having babies? At that point, meaning going through the whole process that they have a healthy baby.
Well, one of the things we can talk about a little bit is C-sections. We have a C-section rate now of 34%. When I entered my first practice back in 1981, the C-section rate was 15%. I thought that was terribly high, so I got it down to 10%. And I did that by turning my breeches to be head first. Sometimes it worked, sometimes it didn't. By delivering breeches and making sure that moms had effective labor.
And that's so important because a C-section, there's a lot more recovery time, and then more chances if they have another child that there could be a serious problem that happens.
Yes, absolutely.
And thinking about that, what does that cause in a situation if you have multiple C-sections? What does that do to the mother and the process of her health and her life that she lives?
Well, it's important. There's something that's called placenta accreta, and that's when the placenta grows into the muscle of the uterus and will not separate. That is increased by every cesarean section. And the problem with that would be two. One would be bleeding, that would be difficult to manage. And the other one would be your next pregnancy.
And women that have C-sections, are there other complications that happen once they have a C-section? That's why you want to try to decrease that number?
Well, yes. One of the biggest problems that we call it to bag a ureter. In other words, the ureter is a tube that goes from the kidney to the bladder. And that surgery, we're right down there with those ureters, probably a centimeter away. So it's not so terrible if you recognize it right away, but it can cause a lot of trouble. You can also get into the uterine artery, have a lot of bleeding. There's something called a C-hyster, which is when they do a hysterectomy to stop the bleeding. I have never needed to do that because I'm an old country doctor. I always use bundle massage, and that has always worked for me.
And that's important. And so what if you know someone who's pregnant and they're getting ready to have a baby, what strategies or tips would you offer to tell the kind of prepare yourself, and maybe with that doctor, especially maybe definitely have that doctor read the book if they could go pick it up and get it for her, but also what should she advocate herself through this process? Because I know through this process that it's very challenging because the decisions that are made are quick and fast. Okay, no, we got to go to the C-section. That's it. What can you, as the mother that really wants to have not a cesarean section, do to try to alleviate from happening, especially the doctor that they're choosing to deliver it?
Well, we're really talking about choice. The patients have an opportunity to do a little bit of background checking on their doctors. Somebody's got who has a C-section rate of 40 or 50% is probably somebody you would want to stay away from.
And can you find out information on the percentage of what their C-section rate is?
Well, I think it's possible. I just don't know. I have never done it myself, but I think you can certainly at least try by asking.
And that means the doctor gets a bill more for the insurance company, if there is an insurance company. Is that correct? For cesarean.
Well, that is one of the big problems of C-section. First of all, the price is about twice as much for a C-section as it is for a vaginal birth. And it's also twice as much for a VBAC, vaginal birth after C-section. So anyway, it's you can also ask, for example, what's the C-section rate at the hospital, and can you tell me about, have you ever ligated a ureter? Have you ever had to do a cesarean hyster? And yeah, I think some doctors would be offended by having those questions asked, but still the moms and dads have a right to know, at least try.
No, that's very good. So your book, tell us more about your book. Is there other things in your book, not just involving cesareans, your book you wrote?
Well, one of the things we've done, which I think hasn't been done much, is informed consent. In other words, you were talking about they decide to do a cesarean section and then everything has to go so fast. But you could actually get informed consent before that time, so you'd know a little bit more. I have on my website, I delivered quads 23 years ago, and they're all living and they're free. We did an hour and 10-minute interview. Dad was kind of funny. He said he delivered, or he changed 7,000 diapers a month.
Oh, wow. That's great. It's a great story for sure. And people can pick up your book where? Where's the best place?
Yeah, ruraldocallen.com. And Allen is A-L-A-N.
Well, you know what, Alan, it's great information you're giving. I wish I would have known that information before, and I definitely will pass it along because, again, the amount of recovery time for C-section, probably other health concerns can happen. And ultimately, the people that make the money are the doctors, if they're, do lots of C-sections, and the insurance companies. So we have to definitely look at not having as many as you're saying. So definitely people need to check you out, pick up your book, and I appreciate you coming by.
Thank you very much, Neil, for inviting me.
You're welcome. You're watching and listening to the Neil Haley Show, and we'll be back in just a moment.